So I want to tell you about haptics, which means interaction through the sense of touch, and it's a very natural part of our daily lives. Without touch, we are lost. We don't know our own bodies, we don't know our environment, it's very difficult to control our movements. But you and I suffer from this kind of sensory loss every day as well when we interact with smartphones and the tablets that we use every day. Now, the importance of haptics came to my attention when I was a graduate student and I was programming robot hands to manipulate objects. And while these hands were very dexterous and powerful, they could easily crush an object if they didn't use tactile sensing. And thus, I began to realize of the need for humans to also have replacements for sense of touch when they lose it. Now, in some patient populations, this is a real problem. When you lose an arm and you're an amputee, you not only lose the ability to move, but you also lose sensory feedback. Stroke patients sometimes lose sensation in their legs due to catastrophic sensory loss. We also have problems with our daily activities due to cold or poor interfaces. Now, it's really hard to recreate the sense of touch because there are millions of mechanoreceptors, or tiny touch sensors, embedded in our skin, force sensors in our muscles, and position sensors in our joints. And so to completely recreate the sense of touch, we would have to stimulate everything. This is impossible at the moment, and so what we work on in my lab are haptic illusions, creating the sense of touch using illusions sort of like visual illusions, where we try to trick someone into feeling something that isn't actually there. And this can be done in a pretty compelling fashion already if you use a haptic device. So this particular one you're seeing a video of now is a stylus-based device where you hold on to a tool, and that is connected to a small desktop robot. And you can move that tool around in space, and the robot will push back at you with its motors when you touch a virtual object. This actually is pretty compelling, but then you're limited to interacting through a tool. What we'd really like to interact with eventually is our bare fingers. And so what we're working on is wearable haptic devices that can get mounted on the fingertips. And the one you're seeing now locally deforms the skin in an attempt to recreate the haptic sensation of manipulating objects. Surprisingly, this works very well. You can manipulate objects in a pretty realistic and normal fashion, even though you're only getting skin deformation and you're not getting pushed back at with large-scale forces. And so the hope is even simple wearable haptic devices will be able to be used to train people in virtual environments and have them learn to do tasks better in the real world. And this isn't just limited to fingertip haptic devices. We also have wearable devices that can be placed at other locations on the body. In this case, vibration motors similar to those in your cell phone that get mounted on the torso and armbands. And in this case, we can learn to make the right kinds of movements based on the haptic feedback received. This could replace, for example, proprioception, loss of knowing where your body is in space. This is enabled by the amazing ability of the human brain to learn. We can get new signals, new sensory information, and we can adapt to it. In fact, this is a lot of what allows Jamie's patients to relearn to move based on the experiences that they're having with the implant. Haptics can also help people learn. So if you get vibration feedback and you're trying to learn a task, if you start learning without haptics, you might reduce your error somewhat. But then when you add haptic feedback, you can continue to reduce your error and improve your task performance. So the goal is using haptics not just for feedback, but also to help somebody learn to do an activity. Now, eventually, we would love to have neural interfaces directly into the brain, like the kind that Jamie showed, in order to provide this feedback rather than signals coming out, as Jamie described. However, we're far from getting there. At the moment, the best that we can do in our research community is feeding stuff back into the muscles. Now, we would like to eventually be able to do tasks like robot-assisted surgery, shown here. These are artificial tissues, by the way, if you're the squeamish type. And there are situations like this, which was mentioned at the beginning, where you would like the surgeon to have haptic feedback. There are a lot of advantages to doing robot-assisted surgery, but we would like to feed that information back to the human operator. But eventually, for some of these patient populations, the feedback is going to have to go into the brain because there may not be an intact body to work with. And so understanding the neuroscience of how the brain processes touch and takes in all this information is going to be critical. And ultimately, beyond going into these practical tasks like surgery or training, there's an aspect of touch that's also very social. And as we live in an increasingly digital world, this connection with people is something that we're missing. But I want to leave you with a question, which is if we can start to replace the sense of touch in virtual worlds and thereby enable people to interact, not in person, but in virtual reality, what might we be missing in the real world? Thank you.